Hello, everybody. Welcome. Thank you for joining us from wherever you are, Baltimore and beyond. We are so happy to have you here today for Spark Showcase, the second day. For those of you that joined yesterday, some of this information might feel a little redundant, but we've got some newcomers on the call and just want to make sure everyone is aware of how today's show is going to go and all the surprises and fun time we have in store. So I'd first like to give some thanks and appreciation to our team. We are small but mighty, as we like to say. Myself, I am the student program manager here at Fast Forward U, handling things from the Spark Showcase, which you're here for today, supporting Social Innovation Lab, finding and sourcing external fund opportunities, and much more. I'm really passionate about supporting our early level ideators and future innovators and constantly looking for ways to collaborate and introduce y'all to some quality entrepreneurial education. I'd also like to shout out Josh Ambrose, our Director of Student Ventures, who is our fearless leader and handles all of our programming opportunities and charges up the growth of our student entrepreneurial community. Followed by Paul Davidson, our Assistant Director of Student Ventures, who is, like I'd like to say, the one that makes sure nothing falls through the cracks. He also co-leads Fuel with Josh. Anthony Waters is our Director of Social Innovation Lab here on the call today as well, handling our accelerator program that is more community facing for not only Hopkins students looking to create a change, but also community-based change makers here in Baltimore. And Elena DeBold, who is our marketing and operations coordinator for all our programming and other sorts of initiatives we run here. We're all on the call today, even though you only see me. The rest of them are hidden, but you'll see them throughout the event handling things on the back end. And now I would like to invite Josh back to share a little bit more about Pava Marie Lepere. Josh?
Thanks, Sephora. And again, many thanks to all those who are joining us today, our judges and all the attendees. Special thanks to anybody who is tuning in for the second day. This is a really exciting growth year for us, where we have so many teams that we have to spread out across 2 days. For those that were in attendance yesterday, you heard us honor our friend Pava, and I just want to continue that spirit of recognition and gratitude today. Pava was one of our strongest collaborators here at Fast Forward U, an early leader and student entrepreneur here on campus who did immeasurable work on campus and in Baltimore to grow an ecosystem of innovators and collaborators. She was my personal introduction to Hopkins and set the bar very high. Her influence is seen throughout all that we do here at Fast Forward U, but particularly with Spark. She was one of the co-creators of the Spark curriculum, and every team that you see pitching here today has benefited from the work that she put in to develop our curriculum and our structure and to keep things moving forward. As a student entrepreneur, she won multiple awards from us, including our highest prize at the time, the Bishotti Student Award, which is still open for applications in the spring. Today, her company, EcoMap, has over 30 employees here in Baltimore, headquartered in this great city. They have raised millions of dollars in venture funding and currently do business all over the world. We can't say it enough. She was a friend to so many folks here in this room today, myself included. And, you may even see, if you've ever been here in person, these words on the wall behind me that say, take risks and move forward. And Pava embodied that with all that she did and all that she pushed for here on campus. So we are so honored to build on the foundation of what she started. And today we invite our teams, our judges, anybody in the audience to really consider, what would Pava do? And to take that as our own challenge and encouragement and moving ahead. So in that spirit of inspiration and gratitude, just again, thank everybody for being here, and happy to hand the mic back to Sephora.
Thank you so much, Josh, for your kind words. Transitioning into today's showcase, love to give a little more context for those that did not participate in Spark but are here to engage anyway. So this semester, we had 34 student teams complete the program, and through those 14 weeks, they went through a rigorous curriculum, learning things from market research, the importance of customer discovery, and even building out their first financial model. Every week, they met with strategic advisors in group mastermind sessions virtually, where we discussed those topics, had engaging exercises to help them understand and deepen their comprehension of those topics. And we also had office hours with them on a fairly regular basis, where we discussed their venture personally. Some of the best things about Spark is that you're not doing it alone. You're connecting with other founders at the same level, earlier, later than you, and having a chance to really challenge and test yourself in a community of people that are trying to make a difference. And also you receive that couch support from some of our great strategic advisors that I'll highlight in just a moment here to help you really understand the material the best that you possibly can. So really proud of what this program does for setting the stage for our future innovators. Speaking of strategic advisors, I'd be remiss if I didn't give them a shout out as well, also on the back end, so hidden but here supporting us. For all of our teams, you are familiar with Selena Shurkin, biomedical engineering student, Alana Thiyi, who is also biomedical engineering, Nandita Balaji, neuroscience and computer science double major, Shrivasthan Rangaraj, who is completing his master's of engineering management, and last but certainly not least, Wesley Hamilton, who is getting her DMA in Viola Performance and Pedagogy. So as you can see, they're coming from diverse backgrounds and each bring their own specific skill sets. We work in pairs for every mini cohort, if you will, and do our best to treat ourselves as one mind. So anytime I get a question from a student that I don't know how to answer, they're my first line of defense because we all have something to bring to the table and do our best to passionately support these students. Several of them here also have their own ventures and have participated and are partnered with Fast Forward U. So really the driving force for a lot of the work that we do here wouldn't be possible without you all. So thank you. And of course, I would want to make sure that we give appreciation and gratitude to the judges that are here today that you will see. The teams already know that they'll be receiving some rigorous questions and have a chance to answer those in today's showcase. So Elise is the strategy and operations officer at Manos Health and also the former co-founder of ClearMask, which is a company that has also partnered and collaborated here at Fast Forward U. Sarah Lee is the current CEO and co-founder of Relevo. Deborah Weidman is the co-founder of New Tech and a serial entrepreneur herself. And Mabinti Kuroma Moore is currently the CEO and founder of Live Africa with a deep knowledge set in impact investing. I'm sure the judges can share more about their experience and background, and it'll definitely shine through our question and answer. At this time, I would like to invite our judges, specifically Sarah and Deborah, who are going to be on the first session for our first round, just so the students can be aware of who will be judging. Thank you. And the money bag, as I like to say. So first of all, congratulations to all the teams. You successfully received $500 for just being here today and making it through our curriculum. Not everybody could say the same, so you should be proud of yourself for just that fact alone, along with the busy schedule and first role you have as a student. What will be decided today is $2,000 prizes that will be decided by the judges for each round, both our first and second round. And the audience will also have a chance to participate and be a decision maker and award $500 prizes for the same, one venture per round. So everyone here today has some stake, and we're so glad that you're here to be a part of this achievement. Speaking of rounds, the structure today is in 2 parts. There are 2 rounds. Each of those will have 7 teams with 2 judges asking questions. They will pitch for 1 minute, followed by 4-minute Q&A. And I ask all teams, if you haven't done so already, I've been going and renaming a few of you as I can. Please make sure that your name, the way you registered, at least has your speaker name and your team name, preferably both, because our staff will be promoting you to panelists so you can come on camera and also pitch. So just as a clarifier for those interested, this is the run of show and the specific team names. I know that my colleagues have already shared the pre-recorded videos that the judges have all watched of the 4-minute pitch, which really gives them a chance to expand upon the concepts they'll be discussing today. And with that, I'm going to invite our first team up with Divway. Whenever you're ready, the floor is yours.
Awesome. Thank you so much. So, hi everyone. My name is Steve Wei, and today I'd like to talk about the Pocket Cast. Ever since the year 2019, more than 7.7 million global deaths is caused by bacterial infection. Even the non-lethal bacterial infections, for example, like urinary tract infections, gonorrhea, can significantly decrease people's quality of life. As a result, people have developed different diagnosis methods. However, they all take extended time, for example, 1 to 3 days, and they all require trained personnel and operations in a lab. So the patients has to go to the hospital, which is very, very inconvenient. As a result, we have developed the Pocket Cast, which stands for a point of care kinetic examination technology combinational antibiotic susceptibility test, which is an accurate, ease of use point of care bacterial diagnosis platform that enables users to operate at home. It is super easy to use. Everything the user needs to do is to unbox, load the cartridge, and load the cartridge into the device. And then a diagnosis result will be sent to the user's phone within 1 to 2 hours. Our business model not only targets patients, but also healthcare providers. And also the market size is very big because bacterial infection is a very common disease. And currently we are still in the R&D stage, and thank you so much for your time.
Thank you. And now I invite Sarah and Deb to share some thoughts and questions.
Great, happy to kick it off. First of all, great pitch, great progress so far, really interesting technology here. Could you share a little bit about the clinical workflow here? How do patients know when they need to use it? Do they need to go to a doctor first to get a prescription for this? What does that look like?
Yes, so it should be a pretty straightforward process. So I'll take urinary tract infection as an example because it's one of the largest disease that we are targeting. So whenever a patient is experiencing urinary tract infection symptoms, they can probably tell from blood in the urine or similar disease itchy or some similar symptoms. They can just start unpacking the cartridge from the box. And then the user can just load their urine sample into the cartridge, and the cartridge is designed specifically for urinary tract infection diagnosis. And then the user only need to load the cartridge into the device, and it's a plug and play device. It's super easy to use. And as soon as the cartridge is loaded to the device started operating by itself, and the results will be automatically sent to the user's phone within 1 to 2 hours, which is significantly faster than the conventional diagnosis.
I'd love to hear a little bit more about how you're linking your solution back to the unmet need, specifically if it is reducing that 1 to 3 days that current techniques are using versus potentially some other reason, like a lack of access, or maybe patients don't know that they have something because they're asymptomatic.
So currently, because we are a point of care diagnostic device for asymptomatic patients, they don't really aware of their disease, so they might not seeking for access for a diagnosis. But also for other patients who are living very far away from hospitals, it will be more than convenient for them to have a point of care diagnosis device. And also for the people, for most of us who don't really like to go to the hospital, having a diagnosis platform at home would be super convenient. And also, like you mentioned, this is a much faster diagnosis, which is 1 to 2 hours. This can prevent delay of treatment, can further improve patient outcome. And also this can prevent the develop of antibiotic resistance. Because of the conventional diagnosis platform takes such a long time, clinicians always prescribe broad spectrum antibiotics for the patients, which can further make the antibiotics resistant issue more and more serious. So having an in-time diagnosis can significantly improve this problem.
So going back to how you answered Deb's question, sort of about talking about asymptomatic patients then. So if patients are asymptomatic, then what is actually prompting them to run this test?
So far, I don't think that is gonna happen because, for example, if I am an asymptomatic patient, I'm not gonna go into a hospital and be tested just for normal life. So this is more targeting symptomatic patients.
Okay, great. And then do patients need to call their doctors to get prescriptions for this? Is this something that they keep in their house at all times in case they get a UTI or any sort of other infection? What does that look like?
It can go 3 different ways. First of all, they can go to patients first, go to the doctors first, and then the doctor might be able to suggest them using this device. And the second one is they can have the device ready at home, which is super convenient. And the third one is actually they can order online, and we should be able to ship the cartridge to their household, and they can run the diagnosis.
Okay, thank you so much, Div. Thank you, Sarah and Deb.
Thank you so much.
We are going to move forward with our next venture. Great way to kick it off. And Kent, whenever you're ready, floor is yours.
Thanks, Sephora. Currently, biomanufacturing companies lose up to $2.4 billion per drug over its 20-year lifetime due to low yields. These low yields result from only assessing 0.1% of potential drug-producing cells. BioLinko is revolutionizing drug production with its platform, which is capable of assessing 2,500 times more cells than competitors. Ultimately, we generate cells with higher drug yields that can reduce biomanufacturing costs by up to 50%. Additionally, BioLinko's team of PhD students and Hopkins faculty has close ties to the biomanufacturing sector through the Advanced Mammalian Biomanufacturing Innovation Center, which has more than 30 companies representing potential customers. To make our vision a reality, we need support from investors like you. Join us as we build BioLinko, a high-throughput cell line development company changing the face of biomanufacturing.
Great pitch. I would love to hear a little bit about how you're envisioning the regulatory steps that would be led by you versus the partnering contractor, since that there is that handoff that happens twice.
Yeah, that's a great question. So we don't actually have to file for FDA approval, but the data that we generate will go into the eventual drug application, biological license application with the FDA. And we will be compliant with all CGMP, like good manufacturing practices, and provide all of that data for the partnering, our company, our customers.
Can you talk a little bit about why some of the big drug manufacturing companies like Thermo Fisher or others have not developed more efficient cell line development processes already?
Yeah. So the major challenge that is currently facing the industry is understanding how early stage cell line development processes are translated and look once it finally moves to large scale manufacturing. There's roughly a 2, potentially 3 month gap between those points. And because you're working with biology, things changed a lot over that time. So bridging that gap and understanding how those two things connect has been the major challenge. And those experiments take a lot of time, months, and a lot of effort that these companies have been both unwilling to commit resources to and unable to find viable solutions for.
And as you're working through your next steps, have you thought a little bit about or any ideas on who would be your ideal first contract that you'd like to lock in?
Yes, we are looking primarily at large biomanufacturing companies. They've already been shown a willingness to invest in research that's up and coming. They're always trying to get an edge on their competitors. And we have a lot of partnerships through the Advanced Mammalian Biomanufacturing Innovation Center. So those would be the most likely first customers for us.
Can you talk a little bit about the IP involved in the company, and then as you get these contracts in place, what the division of IP ownership might look like and how that impacts your business model?
Yeah. So currently we are working with Johns Hopkins Technology Ventures to patent and license some of the IP to BioLinko. And what this actually would look like with our customers is we would own the cell lines that we're using, and we would own like the process, have IP for that, and different peripheral accessories that go with biomanufacturing, like cell culture media. The company that we're partnering with and like is our customer would still have IP rights over the exact molecule they're producing. And this arrangement is already commonly done in industry with CDMOs and CROs. So we would be using that as a model.
Okay, great, thanks.
Thank you.
Hey, Kent, thank you so much. And thank you, judges, for such rigorous questions. We are ready to move forward with our next venture, which will be CellMind and Alfred Landig. Whenever you're ready, Alfred, the floor is yours to pitch.
Sure. Hi, everyone. My name is Alfred Landig. I am second-year full-time MBA student, and I'm also CEO of CellMind. This year, the number of administered CAR-T therapies will reach 100,000, saving lives for many blood cancer patients. Unfortunately, 7% of those who receive it will pass away due to severe adverse effects such as ICANS and CRS. Based on our field market research, those patients initially selected for the therapy did not receive comprehensive pre-screening. The physicians use the rule of thumb for selections just because this therapy is still so new. We developed deep patient biomarkers for patient selection that will tremendously reduce adverse effects. In our experience, we already successfully developed biomarkers for hematology, and the team has multiple patents in this area. Our market is the fastest growing market in oncology with 35% CAGR, and it reached $1.8 billion this year. We plan to license our biomarkers to hospitals, research labs, biobanks, and pharma companies. Right now, we are going through POC with 3 leading CAR-T therapy universities, and we need financial aid to cover our expenses. Thank you for helping us to advance cell therapy and save cancer patients' lives. Happy to answer questions.
I'd love to hear a little bit about the challenges you faced or you observed at Deep Longevity and how that is informing and any learnings that you've had so far with this current application.
Yeah, sure. Well, so challenges that we had in Deep Longevity are slightly different from what we have right now because Deep Longevity was a way larger startup. But I'd say that for us, understanding that teamwork and team composition is crucial to deliver the product quickly. That's something that we learned, and it was definitely a challenge initially. So myself, I was a product manager, and I finished a couple of projects like this before. So luckily, we were successful in this regard. And yeah, so like I cannot tell you more things. So we were just like really working a lot to meet our deadlines, and the hardest challenge was just basically make sure that you are proactive, you're seeing what is going to happen, and you manage those things, kind of not to let your team down. That's it.
Could you clarify a little bit more on the IP position of the company? Or the deep biomarker patents that were previously developed, are those owned by Cellmine, or are those going to be owned by Cellmine or licensed through the prior company?
Yeah,
Deep
so
longevity?
this is a great question. So no, we do not own any IP, but our teammates, they are listed inventors. So basically they made those biomarkers with their own hands. And we believe that we can do the same for a different area, which is cell therapy.
So you're not going to be using any of the deep biomarkers that have already been created. Your company is developing new ones.
No.
Got it. Thank you.
Thank you so much, Alfred. Thank you so much, judges.
Thank you.
With that, we are ready to move on to our next team, Complex DX. Allison, whenever you're ready, the time is yours.
Hello, my name is Allison Chu, and today I'm representing my team, Complex DX. Say your child comes to you with the symptoms of a cough. Would you be able to tell if they had COVID, strep, influenza, or RSV? You'd be surprised to learn that doctors have a difficult time determining what respiratory disease a patient has without the aid of technology. The current process of molecularly testing a patient is very time-consuming and very prone to failure. Thus, we identified that there is a need for a method of detecting pathogens to expedite diagnosis and treatment for time-sensitive respiratory diseases and with overlapping symptomologies. Our device uses a combination of novel DNA nanostructures and a hardware device that allows for the detection of multiple respiratory diseases, specifically 10 plus respiratory diseases, at once using one saliva sample in around 30 minutes. Our device will revolutionize healthcare by empowering clinicians with in-house molecular testing capabilities, thereby dramatically accelerating patient results and transforming the standard of care delivery. Thank you.
Okay, great. Thanks for that presentation. Really interesting technology here. Can you tell me a little bit more about the regulatory pathway that you have to undergo for this product?
So specifically, our device would classify as a Class 2 medical device, so we would have to follow through FDA trials and clinical trials for that. We're planning to do a lot of partnerships with other companies such as CVS Pharmacies and Walgreens, so we'll also have to follow through with their regulatory pathways.
And is there a predicate for this product? Would you be a 510K?
Sorry, could you repeat that again?
So as a Class 2 device, would you fall under the 510K pathway? Is there a predicate device?
I'm not quite sure what that would fall into specifically as of now.
I'd love to hear a little bit more about your specific next steps in terms of where you need to go with your R&D and what the funding would be used for.
Yeah, so currently we're really in the process of getting a patent for our technologies. We want to have a lot of conversations with potential partners like the CVS pharmacies and Walgreens that we were talking about. We want to specifically partner with the Minute Clinics there, just because if we have a testing device there, we can have the healthcare practitioners that work there also use our device. And this would be very beneficial for CVS pharmacies or any pharmacy in general, because they would be getting revenue from patients who need medication from them.
So as far as your business model goes, are you targeting more of a B2B model? And what does that cost structure look like?
So currently we have different go-to-market strategies. The first one that we were thinking about was actually targeting very private clinics, like mom and pop clinics, because we would be able to do a proof of concept there in a way, and then we would branch out to larger basically chain clinics. And with that, that would be a B2B. In addition, the other go-to-market strategy that I mentioned before was partnering with the CVS pharmacies, and that would also be considered a B2B.
Okay, great, thank you.
And it looked like your team was maybe one of the larger teams, and maybe it seemed like it could have been spun out of the design team program.
Yes, it was.
Awesome. So I'd love to hear about just in terms of managing such a large team, but is so focused on biomedical engineering, if you're thinking about needing to diversify the expertise within your team.
Yeah, so we have a lot of expertise in the wet lab and also on the hardware side. We were blessed to have a lot of people who are very involved in the wet lab side, and we're definitely thinking about branching out to many advisors. This is a conversation that we have all the time, and our advisors are currently in the Department of Pathology, and he's in the Larman lab, so he's been helping us a lot with also developing our technology. We're also reaching out to different advisors and people that are basically alumni that work in like the CVS pharmacies and things like that.
Any last questions? Okay, seems like we're all good here. Thank you so much, Allison. Really appreciate you being here to pitch, and thank you, judges. With that, we're going to move forward with Deepnosis. LM, whenever you're ready.
Okay. Hi, I'm Dr. Ilham Jamshidi, co-founder of Deepnosis. In Deepnosis, we are focused on personalizing medication management based on drug safety with machine learning. Adverse drug reaction cause over 100,000 deaths and rack up $100 billion in yearly costs in just the United States. So imagine if we could predict these reactions before they happen. That's where Deepnosis comes in. We analyze patients' personal and medical data at the point of care to predict exactly what kind of side effects they will experience after getting a drug. And our model could help physician and also pharmacists personalize prescription and prevent serious side effects. We've already patented our technology and are gearing up for pilot trial with Hopkins Hospital. And our goal is to validate our models and show their use case in the real world settings. And we are looking for partners who can help us in this trial and raise our seed fund.
Thank you,
Great.
Ellen. Whenever you're ready, judges.
Great, thanks for that presentation. So as you're going about sort of going through those clinical studies and validating, how are you measuring success here that's in a way that's clinically applicable?
Sorry, can you repeat that? I had a very bad, vague voice.
Sure. How are you going to be validating the efficacy of your model in a clinically relevant way?
So we are actually looking at a different, criteria for our clinical trials. And, if I understand well, the nature of our product is in a way that we should somewhat, analyze different factors like the survival of patients and also the approval of doctors. So we are looking at different things and designing a clinical trial based on kind of new product is hard, but and we have also a team that is looking and analyzing similar products. And also, if I get it correctly, we want to understand the success rate. It's like, now we know the statistic that how much people, when we don't have this, without our AI, okay, how much we could decrease the specific side effects. We can easily have this.
Continuing off of that, in terms of validating your solution, in addition to, of course, predicting what the adverse reaction would be, are you also quantifying the likelihood of that happening, or is it a binary, yes, this adverse reaction would happen, or no, it wouldn't?
That is exactly the goal of Deepnosis. The difference between our product and traditional approaches, it's that physician actually they are actually take it, and so we have a proof of concept website that actually show that we can predict ADRs in a better way and with accuracy. And right now they have the old-fashioned and traditional way that they can predict the percentage of the probability of side effect based on the previous side effects. But right now, in our website, we also show that we can, with the accuracy of more accuracy, we can tell them that which side effect with which percentage that they can show, and also it's completely personalized to the person. And if one side effect goes up than the normal range that we define in our website, it kind of help doctors to decided if they want to take a kind of prophylactic action, or they can want to change the treatment goal.
Could you talk a little bit more about your business model? Who exactly would your customers be, and why would they want to purchase an additional software product?
Okay, exactly. Our business model is a kind of straightforward. We are developing a B2B API to integrate into provider system, offering them a way to personalize their services. And our revenue model will be based on the usages, scaling with the request. And also our primary customer are going to be BHRs, I think payers and pharmacies. And they are the ones who service physicians at the point of care, and will also gain the financial benefit of our approach. So we aim to integrate with their system to have professional personalize their care based on our prediction. So we can see other revenue streams from customer integration to data analytics service as well. But our main focus right now is on API as a product model.
Thank you, Elam. And thank you, judges, so much for your questions. We are ready to move forward with our next team, which will be Illuminate Health Assistance with Amanda. Whenever you're ready, Amanda.
Thank you, Sephora. Hi, everybody. I'm Amanda, and I'm a healthcare worker. And in my 13 years of experience, one of the biggest problems I've seen is that people just don't know or understand when it comes to the ins and outs of healthcare. I mean, how many people here can confidently say they know the details of their healthcare coverage? Do you know what your out-of-pocket maximum is? Or let's say, how many people have been hit with a medical bill after paying your copay at the office? That's where Illuminate Health Assistance comes in. We are your healthcare personal assistants. We use our industry knowledge to bring you personalized, end-to-end administrative support when it comes to healthcare. Our services address an $80 million market, and today we are looking for $2,000 to further our customer discovery and market research through customer interviews, hypothesis testing, and the GHX Healthcare Summit in 2024.
Awesome. I would love to hear a little bit about if you've already conducted interviews or received any feedback on the pricing for your product.
Yes. So I've conducted 26 customer interviews with Southwest Florida, I would say potential customers, as well as the Chicagoland area. We're looking at pricing structures that are based similarly to what insurance agents and brokers make on their fees, and pricing it similarly, but offering more services than they do.
How do you envision this scaling up long term? Would you need to hire a large team of personal assistants, and how is that going to scale?
So for the immediate future, we're looking at targeting areas with high concentrations of retirees, so individuals over 65, of the middle to upper income levels. With that, we would have small teams at brick and mortar locations, but in the long term, and I'm thinking probably over like 10, 15 years, I would like to move into larger cities and kind of build this as what H&R Block is to taxes, we would be to healthcare and insurance.
And then right off the bat, getting your next more immediate steps completed, who are you looking for in terms of expanding your team, or what hurdles do you see in the short term?
Great question. So my ideal team, I really want it to be a collaborative effort. So I want to hire people of differing backgrounds within healthcare. Ideally, I'd like to have RNs, case managers, social workers, medical biller, and coders, and then give them the tools to become insurance brokers so that they understand that side as well. And then in terms of the next steps, what I'm really looking to find right now is a co-founder, and then my initial 1 to 2 team members to get things started.
Are there any plans to integrate some sort of technology to automate some of these processes, or is it really reliant on personal assistants to sort of do more manual research into different health plans?
So I want to keep the human element in place because that's what our customer interviews have really given us insight into. But there is going to be what we're looking into right now is licensing of a technology that the assistants use. And it basically links all health portals and health data.
Okay, great. Thank you.
Any last questions? Okay, it seems that we are all good here. Thank you so much, Amanda. Been a pleasure hearing you pitch today. And with that, it brings us to our last, but certainly not least team of today's first round. Ahmad, whenever you're ready, we'd love to hear your pitch about Touch Drive.
Hey, can y'all hear me?
Yes.
Awesome. Hey everyone, my name is Armand and I'm a co-founder of Touch Drive, an advanced device company making an efficient and non-invasive BAC level detecting biosensor with a data backend in order to decrease DUI incidents. Our planned revenue model is B2B2C, where actual consumers are professional drivers at companies like U-Haul, Uber, and FedEx. Our intermediary customers are insurance companies like State Farm and Allstate. Our plan is to license our product to insurance companies who can then sell the sensors to professional customers with incentivized policy rates. Our product targets the 3 big issues with current products on the market: accessibility, efficiency, and automation. Our team consists of 3 students at Hopkins and UT, as well as adjunct professors at Harvard and MIT with over 20 years of experience in biotech startup. Our vast array of education and interest, as well as deep experience in this topic, compels us to believe our team is best apt to tackle this problem. We're hoping to utilize your investments to bolster and expedite our MVP process. Oh, sorry.
Okay, great. Thanks for that pitch. So in your longer form video pitch, you mentioned that this is really kind of the perfect time to be entering the market. Could you expand a little bit on why that is?
Yeah, absolutely. So I think one of the biggest trends right now in insurance is data, where insurance companies want data on how their consumers are driving behind the wheel. I think a big evidence of that is technologies like DriveWise, which Allstate utilizes to get statistics on how a car is driving, such as, their speed, acceleration, braking, whatever. But currently there's no product on the market that shows how the actual driver behind the wheel is acting. There's no metrics to measure that. So there's definitely a trend where insurance companies want data, and yet there is no actual product that provides data on the driver themselves. So there is a market gap that we believe we can fill with our product.
In the longer form video, you also mentioned an override feature as well being included. Could you talk a little bit about the workflow and situation where you see that being used?
Absolutely. I think one of the biggest things we want to emphasize with our tech is that this is not something that locks your car. That's something that current products do. And there's been a lot of both ethical and legal issues with that. So we want it to be a open-end interface where you use it when you can, and there are override features where, for example, if it reads a BAC level over 0.08, you can say, you can choose not to, I guess, report that to your management. Those are some very specific contingent cases that will have to be worked out between management and like the actual drivers at these sort of companies, and it's not something that we want to use our discretion on, but it is a feature that we want to have available.
Do you have any IP or planned IP around your technology? And if so, what is the differentiating factor between other products on the market?
Yeah, absolutely. We don't have a current IP right now, though we are definitely working on making an MVP and applying for a utility patent. The current patents on the market utilize similar technology or similar sciences with like electrochemical sensing and sweat emanations. But currently there's no patent that extracts that technology into like the actual circuit board of a car. So we want to use the patent, apply for a utility patent that does a culmination of that science and the application of it into a car circuit board.
Could you expand a little bit more about the competitor, I believe you put that was coming out later in 2024, the government backed solution?
Yeah, absolutely. So that program is called DADS, where they're based in the DMV area. And currently they have a contract with General Motors where every single car produced by General Motors after 2024, or I believe they extended it now to 2025, will utilize this type of technology. Now, what they're doing is making it more of like a accessory. Like, do you want an extra camera in your car? Check. Do you want upgraded tires? Check. Do you want the safety feature in your car? Check. So now I believe that one of their biggest issues is that they've wholesaled their product to General Motors. So though they have a pretty big market with them, they can't scale it any further than General Motors because they've been bought out by them. I think what differentiates us is that currently we want to focus on insurance companies, but we have the possibility of potentially scaling this to a market past cars where we do it with planes, trains, or even going into academia or getting legal implications where we're working with the police force. So I think we can make our product a lot more scalable than DADS, though our sciences are pretty similar.
All right. Thank you so much, Sarah and Deb. Thank you, Armand. You bring us to the close of our first round. Hope everyone has enjoyed. All right, y'all. It is 12:52. So as promised, we're headed right into our second round. I see, Talia, you're already here, ready and eager. We'd love to hear your pitch.
Yes, thank you, Sephora. In 2023, we have more health data than ever before, from clinicians' notes and lab results to wearables, health apps, and so much more. Health Cloud, a secure AI-based cloud platform, aims to be the first company that not only centralizes all your health data, but gives you complete control over your own data, allowing unprecedented levels of insight and healthcare decision-making power for consumers. We're entering this $13 billion market with proprietary AI algorithms that will synthesize and monitor your data, recommend personalized interventions to help you optimize your health, and auto-generate health sprints to keep you on track. All the while protecting your security and making history by giving you, the healthcare consumer, complete control. All for $6 a month. I'm Talia, CEO and founder, and a former Deloitte Senior AI Strategy Consultant, and I hope you'll join us in our launch of 2025. Thank you.
Thank you. Judges?
Thank you, Talia. This is a really great presentation. I'm curious, in terms of the type of a degree of data that Health Cloud will provide, how in-depth will this data be compared to what a consumer would typically get from their health practitioner?
It will be very in-depth. I would say that's probably our key differentiator. And I think this is a fantastic question. So I'd love to go into the details a little bit. So essentially, the model is going to be trained on two types of data. First, foundational knowledge, and two, individuals' data. So all the data that would pertain to one individual and their health outcomes. So first, in a fashion somewhat similar to ChatGPT and how that was developed, the model will be loaded with all medical information that is publicly available, from information on diseases, disease pathways, drugs, drug interactions, published research, et cetera. And that will really form the foundation of its knowledge. And there are already plenty of APIs to build this. And then second, for individuals' data, the model is going to be trained with a robust data set of 500,000 records that has aggregated medical records, lab results, extensive questionnaire data, wearables, whole genome sequences, And soon this data set will actually include proteome and transcriptome data, which are still really new. In fact, I would be quite shocked if any of you have ever been able to leverage this kind of data with your own doctor, but it is on the horizon. And while 500,000 records is actually relatively small in the world of AI, my experience to date building AI solutions for this kind of purpose, which is not artificial general intelligence, but rather specific objectives, right? So, which biomarkers should you get tested? Really just relies on pattern recognition, which is something that AI is already very good at, and leads me to strongly believe that this level of data would be sufficient to provide a dramatic improvement in precision medicine over what doctors can currently provide, which will make the solution valuable for people even at an early stage before we have data from real users to continue improving it. And just one personal anecdote I want to throw in is I have so much data because I'm so interested in diagnostics myself. And when I ask my doctor whether they would like to leverage it, they don't want to use it, which I always found very interesting. But there's already data available that they're not using simply because of oftentimes like time constraints, and maybe they're not experienced with like that particular data. So they don't really want to leverage it in the decisions they're making, which I think is a missed opportunity.
Hi, Talia, great presentation. You're great at you're great at the pace of your speaking and everything. It makes it really easy to understand. So great job at that. I have a question about integrating into the healthcare system. So let's say you are the type of persona that you describe, in where you have lots of different data, you've heard different things from different types of clinicians, and let's say you get some information that you think would be helpful. Can you walk me through how that persona would deal with the healthcare system that may or may not, as you mentioned before, be open to that information? Let's say they feel confident in what they need to move forward, but how do you get the existing system to work with you and work with that patient to move forward to a solution?
Yeah, that's a great question. So typically the data doesn't lie, right? If you're saying, hey, look, I'm presenting with a genetic mutation that makes me, have a higher risk factor, and these 3 biomarkers, this pattern together represents this diagnosis, what do you think? Most people, when presented with that data, will either say yes or no, and here's why. So I think that like if, for example, something is missed, but usually when you're presenting with the right data, people can get behind that. And I actually think that's what's missing in a lot of the experience I've had in healthcare is data that can actually confirm or eliminate a condition. For example, we still have a lot of conditions or disease labels that are really just almost the absence of a condition. Like IBS is a great one. That's basically, we don't know what's going on with your gastrointestinal issues, IBS, right? And the reality is there is a biochemical process that is going on there. We just don't really fully understand it. And that's one of the reasons, for example, why IBS is very difficult to treat, because it's probably a lot of different things. It's not just one thing, but we are just now getting to this level of data where we're going to really be able to actually pinpoint biochemical processes. And we really don't have a medical system that's quite set up for that.
Hey, thank you so much, Talia. Definitely could listen to more of this, but we do have to move on. Appreciate you being here and pitching. And Mabinsi and Elise, of course, thank you for your questions. And with that, we are going to move forward with Aishu. We'd love to hear more about Tibi. The floor is yours.
Absolutely. Hi, everyone. My name is Aishu Nag. So approximately 25 million people in Indonesia are working parents. Many of them have moved far away from home and their communities to fully invest in their career. And as such, they're facing a growing problem. How do they get access to safe, reliable, and high-quality childcare? This is where Tibi comes in. Tibi was created to help working parents make sure that their young children are well taken care of by connecting them with trusted childcare specialists. Through our user-friendly app, working parents can search available childcare in the form of registered nannies and babysitters. Parents can apply filters, look at reviews, and eventually book childcare all in a few easy taps. Indonesian parents have every right to pursue the best economic opportunities for their families while also ensuring that their children are well taken care of. So use TB, the only platform that enables you to make the most out of your present while also caring for your future. Thank you.
Thank you so much.
Oh, go ahead.
Go ahead, Elise. Go ahead.
Sure, I'll make mine quick so we have time for both.
Yeah.
I'm curious, I did see in your longer pitch that you guys actually launched, so big congratulations on that.
Oh,
and I'm
thank
curious, yeah, you're welcome. I'm curious how you work with safety and ratings, because safety is very important for caregiving. And so how do you get somebody in there that, let's say, has a 5-star review, but an incident happens? How do you do that safety monitoring and reporting?
Absolutely. So there's a couple of key components to this, and definitely something that we're having active conversations around, because you're right. Like, for instance, my own mother is a childcare specialist. And so I really understand how much safety matters, especially for new parents. So right now, we've, of course, got our rating system in place, but we individually actually screen and work with all of the registered nannies and babysitters that would like to be available on our platform that have access to our users. So we initially go through a screening process, and then we also continually check in with our registered users. I mean, thankfully, we're small enough where we can still manage that. But we check in with them and continue to check in with our parents and make sure that everyone is very comfortable in the situation that they're in. So we've got a regular sort of check-in process that we've cleared, and we plan to continue expanding that as we continue expanding our growth and have more users on the platform, of course.
Great for answering that. That was one of a really great question, and also really helpful to understand that you have a vetting process in place. I was curious about, does Tibi provide services for parents who have emergencies, which tends to arise where you have a sitter or a childcare, but for whatever reason they're unable to? Does Tibi provide those impromptu emergency care? And then how do you ensure that that care is provided in a timely fashion, even though it's an urgent matter and that scenario tends to come up?
No, totally. So the best way that I can think of TB in terms of comparison is to compare it to sort of an Airbnb type of application, right? So there are certainly situations and emergencies which arise where either a parent needs care immediately, or if a nanny or a registered babysitter is sort of like, hey, I'm so sorry, I had an emergency and I can't take care of your child. So in those situations, we have two processes in place. One is that the parent can immediately try to see if there's anyone that's available that's within a certain quality range for their child to take care of their child. And if they have any issues finding that, then they're more than welcome in our second process to reach out to us directly, and we'll try our best to see if we can arrange for care. Thankfully, it's a small team, and the number of clients that we currently have is kind of small. So this process works for now, since we're still scaling. We're definitely interested in keeping it in place as we get larger, but again, that's entirely something that we're still working on.
Fantastic. Congratulations on that.
Thank you.
I have a kind of a follow-on question related to your vetting and screening. Will you also be screening for health? Will it be a requirement for childcare providers to adhere to kind of health standards in terms of vaccinations or other health requirements to ensure that when they're engaging with some of your consumers' children, that the health risks are limited?
Oh, yeah, absolutely. Like you said, safety is it's incredibly paramount in our organization, right? But as is the actual health of the children involved. And we know that that's often a complaint that parents have when they take their children to daycare, is that if one kid gets a cold, suddenly everyone's children have colds. So health is something that we take very seriously. It's one of the reasons why we're currently in conversation with our nannies and our babysitters to make sure that there's a maximum number of children that any one person can take care of any moment. For that, we're actually following the Indonesian legal regulations, because we want to make sure that we're compliant within that country's safety standards as well. Personally, we want to stick to the highest level of safety and care, so we would want them to have all of their vaccinations up to date, both for the parents, both for the nannies and babysitters, as well as the children that are incoming, because we want both parties to have a safe experience at the end of the day and be able to kind of provide safety and service in a very safe setting.
I'm curious about. Oh, are we out of time?
Go ahead, Elise. I want to make sure that you got a chance to ask a follow-on question too.
Great. I'm just curious about your model and its specificity to Indonesia and how it could be expanded to other countries in that region or beyond globally.
Yeah, so actually the reason why we started in Indonesia is my co-founder, August, whose contact info is right there. So he's from Indonesia, and this is actually one of the biggest concerns that he noticed with the community in which he grew up, is that there's been this more recent generational shift of essentially people pursuing, jobs and careers in a larger city. And in some ways, the society is a little bit more traditional, where people tend to get married and settle down and have children very young. But now we have this added problem of not living near your family anymore. So childcare, which was once kind of in-house, if you will, or your children are taken care of by your family, has now been expanded to trying to find appropriate childcare services and things like that. And so since that isn't as nearly built out in Indonesia in a similar way as it is in the United States, and people are always looking for an optimal option, August really thought that this would be the best market to start with. And then I think depending on its success here, we'd be more than happy to branch out to other countries and other cultures. It's just that here we saw that there was a really unique need in this space for this type of service. But ideally, if it's a hit, we'd love to examine other countries and cultures and see where we could expand.
Thank you so much, Aishu, and thank you, judges. With that, we are going to move forward with our next venture. Kelvin, whenever you are ready, we'd love to hear about Stacked.
All right. Imagine coming to Hopkins, excited to explore new interests and get involved in awesome campus events. However, once you start looking around on Hopkins groups, Instagram, and multiple other platforms, you quickly realize how difficult and time-consuming the process is. This is how me and many other first-year students felt. Furthermore, 53% of undergrad students interviewed reported strong dissatisfaction with Hopkins groups, despite the administration paying over $50K per year, with that cost only going up. What students need is not simply a redesigned Hopkins groups, but an entirely new platform where events that cater to their diverse interests, from research to a cappella concerts and major specific events, can be found in one place. So far, I have interviewed Calvin Smith, head of the office that operates Hopkins groups, and he is willing to help the development of Stacked. Our plan is to first get students to adopt the platform, next for clubs to advertise their events through Stacked, and once we have a strong user base, make a proposal for the school to buy the platform. Right now, we are at a pre-product stage looking for a technical co-founder. If you would like to be a beta tester, please email me at the link in the slide. Looking forward to hearing back.
Great job, Kelvin. You gave a really great pitch today, so thank you so much for that. I'm curious about your scale. So it sounds great that you're starting locally at the Hopkins chapter, and that's always a great place to start near to Hope. Yes. And I'm curious why you selected just one campus versus going ahead and creating a platform and wanting to do it nationwide.
Right. So I think it's really because I have the most leverage here at Hopkins to first get the students involved and then have the office adopt the platform. And it's really once the office tests and realizes how great the platform is, that they will then tell other schools that use platforms such as Hopkins Groups. So Hopkins Groups is actually a version of campus groups, and they have a monopoly on the student organization market for higher education. So our goal is to essentially create a competitor to Hopkins Groups that offers a better user experience that's more accessible for students and for faculty.
Elvin, thank you so much for your presentation. And I just certainly remember the days of being a Hopkins student as well. So I appreciate the personalization of your pitch. I'm curious, how do you plan on driving adoption and further marketing this?
So for adoption, it's definitely, we still need to create a beta version of the app, but it's really, once we create that, then it's really just asking students to download the app, try it out, give us feedback. And I think there really is a huge market for this because like I've said, many of the students I've interviewed reported it's difficult to find what's going on because you got to check Outlook, you got to check Hopkins Group's Instagram. And on each of these platforms, there's different types of events. So it's a very time-consuming process that students want a solution. And it's really once students adopt the platform, then clubs will also want to advertise their events so they can also get their events promoted.
You talk a bit more about monetization. I know you mentioned advertising. Can you speak a bit more in terms of other ways that you can amplify monetization opportunities for staff?
Yeah, for sure. So our goal is to keep it free for students, but really incentivize clubs to pay to advertise their events on the platform. Like, I think this is an area that I still need to do more customer discovery with, but for the clubs that I have talked to that have struggled finding new members to join their organizations, like this platform creates a better opportunity versus like flyer boards or other archaic methods, because not only are they giving this platform where they can like promote their events at the top, but they will also get like advertising tools to like reach specific demographics of students who might otherwise not have known about their club.
Any other questions, Mabinti Elise?
Yeah, I'm curious if you've looked at any financial models and the ranges that you're looking at charging clubs.
Yeah, so our plan, and once again, this we do need to do more testing, but for now, we're thinking for 1 week, we'll charge $10 for promoting their advertisement, and for 2 weeks, $15. And we looked at like if there's 50 clubs that use this, and like at Hopkins, putting that in perspective, there's like over 400 student organizations. So if there's only like 5% of those clubs that use this and advertise, like, let's say like 4 times per year, then we're looking at like over 100K just from these clubs and student organizations using this platform. And our plan is to then finally sell the platform to the school, where they will also have more control.
Okay, thank you so much, Calvin, and thank you, judges.
Thank you.
Excellent pitch. And with that, we are ready to move on to our next team. Terry, whenever you're ready, we'd love to hear about High Five. Just taking one moment to join. There you are.
Hello.
Hello.
Okay. Me High Five Code Companion, the groundbreaking solution to your coding journey. I'm a Johns Hopkins student, and I'm excited to co-found High Five. We're currently in the market research stage. Coding complexity and time-consuming product engineering often hinders your progress, but this is where High Five will truly shine. High Five Code Companion sets us apart from the rest. We eliminate prompt engineering and offer a seamless, user-friendly coding experience. But what truly makes us unique? Well, here are some of the core features. Number 1 is a user-friendly interface. Code generation in multiple languages. Real-time assistance and debugging support, as well as community and collaboration for developers. With the extra funding that we may gain from Spark, we will devote that to product development, market research, as well as community building and team bonding. Our dedicated team is passionate about making coding accessible to all. Join us on this journey to redefine how the world codes. Contact us to get involved in our research or express your interest in our Code Companion. Let's high five to the future of coding, powered by innovation and community.
Great, thank you very much for that. Can you talk us through your monetization model, and then how you're going to make money, who you're going to charge, and how that all works?
Yeah, so our primary market is software developers and companies, software developing companies, so like teams of software developers. And we're planning on doing a subscription model. So we plan on doing like $10 or $15 per month in order to subscribe to the software, or like $100 per year annually to subscribe to the software.
Great. And to clarify, how many users would that cover?
I planned I did our financial model using approximately 2,000 users spread out across the different population groups, different markets. And with that amount, we calculated our own financial model.
Terry, thank you so much for this presentation. I would love to learn more about how you're going to make it a more user-friendly interface. Can you describe how High5 will do this in a more friendlier way compared to other platforms that exist?
Yeah, so our main feature is that you'll be able to use plain English in order to essentially prompt the software to code in a language that you want, and also to generate code snippets that can use in your own program. And this will be very user-friendly because it's in plain English. And also there will be like a forum where you can share different code modules with each other, with other users within the community. And that will allow users to essentially like reuse other people's code without having to go through the same process.
To get this High5 to a level that is market ready, what would you say is the overall cost? What is the ideal budget in order to really see it to its full extent?
So in order to develop an MVP, I believe we only need like $5,000 to $10,000 for a fully fleshed out MVP. But in order to reach full market potential and cover like the hundreds of thousands of potential users, it would require a much greater number that I have not calculated because I feel like there's no meaning calculating that far.
Thank you for answering.
All right. If there are no other questions, we are ready to move forward. Thank you so much, Terry.
You're welcome.
And Stephen, whenever you're ready and able to pitch, we'd love to hear more about Dory AI.
Yeah, sure. So, hi, this is Steven. So, have you ever experienced frustration when you're just trying to look for the perfect t-shirt that's true to show who you are, but you actually just end up with finding nothing? Or have you found yourself like spending huge amount of time just searching for the perfect ideal gift during this holiday season for yourself or for your family members? Well, here's the Dory AI. So as AI researchers, we'll be utilizing the power of AI-generated content to empower you to bring your own design idea into life. Just through simply a few words, you can get your design and the t-shirt and backpack unique for you. And with our directly connected flexible supply chain in China, you can get your touchable design at a really low cost. And we're also here to save your valuable time on choosing the perfect gift. So just chatting with our AI chatbot, we consider your unique interests and preferences to assist you in selection, not only for you, but also for your family. And different from a traditional customized design platform like Redbubble, our goal here is to help you to unwrap the idea in your mind and discover who you truly are and bring those brilliant ideas into life.
Thank you, Stephen. I appreciate your enthusiasm in that pitch. That was great.
Thank you.
You talked about utilizing the supply chain systems in China. I'd love to hear how your company is differentiated in utilizing the systems compared to a lot of other systems that also use those supply chains.
Yeah, so basically currently we are like collaborating with a manufacturer in the south part of China, which is already well built with shipping system and production line, and they can also already provide us around 60 different types of products that be able to flexible product with, and we've also been trying to actually use it to try it out, and we can get our product really fast in around 1 week of shipment. And as we see, the cost is actually really low. Usually like for a t-shirt, the product cost is just around $5 to $6. But as we see currently, our competitor at Teespring or Printful, they actually sell their customized design t-shirt at around $20 to $25. So we're actually pretty competitive to get the market in a much lower cost price as compared to them. So Yeah, but at the same time, we are also trying to, because personally myself, I'm from China, so I'm also trying to expand my connection in those regions of China. It's really now it's really pretty mature in this kind of flexible supply manufacture with lots of factories, different supplier, and we try to expand so we can plan the option based on manufacturer quality, material selection, and also better selection with the delivery, shipping to make overall quality to improve. So
Thank you, Stephen. Appreciate your presentation of Dory and the enthusiasm that you have. I'm curious if you could detail a bit more about your marketing strategy and then talk about how you plan to scale.
yeah, sure. That's actually a pretty good question. So as we can see on my one page here on product roadmap, the first stage we actually connect through campus because our target user group is around 18 to 35. These kind of mostly Z generation who are really interested in AI technology and also want to do customization in fashion design to show who themselves are. So Canvas is actually a really good place to start from, where we can get connect to student organization and also probably do campaign on Canvas to do some marketing, connect to students, and also connect to students all over the US. It's actually already pretty large user group, and it's around like 18 million currently enrolled students in the US colleges this year. And then from that point, we want to scale up through social engagement. As we see, there's a really great popular place talking about AI. It's YouTube, TikTok, Instagram, and it's also not a huge number of users on it, ranging from 18 to 35. So that's kind of scaling up from 18 million users to like around 60 million and even higher, around 100 million users. So yeah, and at the end is we try to further expanding, not only limited to probably Z generation younger group, but also more generally people interested in design, either amateur or professional.
Any last questions?
Yeah, I'm curious what safety features you have in place. Let's say somebody wants to create a t-shirt with something like a swastika or something like that. What types of safety features would be in place in order to address a situation like that?
Yeah, so in terms of safety here, so it's actually some common issue faced by this kind of AI generated content like ChatGPT or diffusion model. It's like initially we have the front gate keyword filtering at first, so that can be step one. But also personally myself is actually my person is actually AI safety worker as well. So we are actually also built up based on even higher level from the inner semantic level, how to build up defense, because I'm really bad at generate content. And also there's also some operational side like commonly faced by like Instagram. What if people publish something bad, use your tool? It's like with some legal issue, and we have to do some legal consulting to construct with the rule like on our platform to like disclaimer, legally disclaimer thing as well.
Thank you so much, Stephen, and thank you, judges.
Thank you.
All right, moving right on forward with our second to last team. King, whenever you're ready, love to hear about Early Bird.
Thanks, Sephora. Hi, everyone. I'm King Pasquale, the founder and inventor of Early Birdie, and I'm a resident physician here at Hopkins as well. Combining my medical background and passion for wellness, I've developed Early Birdie, the world's first sleep hygiene and productivity trainer. So many of us know that our society faces a sleep epidemic that's worsened by smartphone addiction. In fact, you or a friend of yours are most likely part of that more than 50% of smartphone users who doom scroll on their phones at night and chronically snooze their alarms in the morning. And this is a problem because it leads to poor sleep hygiene and reduced productivity, and it also has long-term health effects. Unlike its competitors, Early Birdie is low-tech, multifunctional, affordable, and snooze-proof. And our vision is not just a sleep hygiene product, but overall a movement towards normalizing wellness. So with that said, thank you for not snoozing, and I hope that you join me in helping people sleep and wake up the healthy way.
Thank you so much for this presentation. I know that as a person that is always eager to get more sleep and balance, this is an area of my life that I'm still working on. So I was really interested in hearing your pitch. Can you talk a bit more about, you say that it's multifunctional. What are the other features of Early Birdie? And then can you walk through different scenarios that you kind of tested or maybe thought about in which this works, or maybe there may be some challenges if someone loses the key, or kind of, can you discuss that a bit more?
Sure. So I mentioned that it's multifunctional because based on the customer and user feedback I've received, our users have used it like while they're studying in their libraries, for instance, to lock their phones away, to hold themselves accountable to being productive. So it's not just a tool that helps you sleep better at night by reducing screen time, but it also helps with productivity overall during the day. And in fact, some parents have also expressed utility for their kids, their teenage kids who are obviously addicted to their phones. So I've been getting a lot of feedback based on that. And regarding the concerns about challenges with the user experience, the product comes with 2 keys. So I encourage the users to just keep the spare key somewhere, like, in their room, in case they lose that first key.
Congratulations on starting this company during residency. I'm very impressed. So that's great. I'm curious about the IP that you've arranged for the company, if you can talk through the status.
Yeah, so I filed for a utility and a design patent. So the utility patent was provisional. Unfortunately, the design patent actually did not pan out. So that's one thing that I have in my radar this upcoming year. Provisional patent expired already, so that's also due for an actual application. So these are things I'm going to be working the next couple of months.
And speaking of design, I'm curious what other designs you considered, if there's different colors or materials, and what made you decide on this final design?
Yeah, so I wanted something that was sleek and can blend with in the interior design of any person's home. And I also wanted it to be made out of a sustainable material. So plastic was a no-go for me. I wanted cheap material that's sustainable. So pine wood was actually one of the materials suggested by the manufacturer I partnered with. So we went with that.
Great. And can you talk through the unit economics of how much it costs to produce that, what your profit margins look like, and how you plan to scale?
So the manufacturer quotes are ranging from $5 to $7, including the lock and key and the delivery, depending on the purchase order. In terms of like us selling it, I've been selling it for $19.99. So we have, just depending on the price and the purchase order, that's our profit margins are at least $15. Hopefully with larger purchase orders, we could scale that down even further.
Right. Sorry about this. I don't know what happened, but it just went off mid-question. But I heard some of the feedback, so thank you, King, for some of those details.
Any last questions from you, Mabinti? I know you got dropped off there for a second.
Yeah. I was curious about the price point, how you arrived at that price point, and then I guess the question around design touched on the question I was attempting to ask of how is this different from any storage product?
Right.
Yeah.
So the price point was pretty much based on like my research on Amazon for like similar products, and just qualitative surveys from my users as well, like how much they would be willing to pay for something like this, and most of them said no more than $25, no more than $20. So that's part of it. And as far as like competitors, there's really no product out there that is designed in a way that prevents snoozing and also locks your phone away. There are products that do lock your phone away. A lot of them are battery operated. So a lot of the reviews on Amazon for these plastic lock boxes for your phone to like hold yourself accountable for productivity, they actually malfunction. So it's not targeting the sleep hygiene issue at all. This is the only product right now that does both.
Thank you.
All right, thank you so much, King, and thank you to our judges. With that, I see Jasmine is already here and ready to present. So let me transition us over to, last but certainly not least, the safe space with Jasmine.
Hello, everyone. My name is Dr. Jasmine Kaur, and I left my career as a psychiatrist in India to come to Hopkins with a mission. Feeling safe, feeling heard, and feeling like you belong. This is brought to you by the Safe Space for anyone who feels emotions. We are one of a kind of an app that provides you with information through trusted sources, a place to keep a log of your emotions and access affordable resources to empower you to choose for your mental health. In essence, the Safe Space is a social media for all your mental health needs that connects you with others who feel and understand your emotions. To the judges and all the people listening to me right now, there are 8.1 billion people to reach. And for that, the Safe Space needs your support by prioritizing your mental health. Let's start together. Thank you.
Thank you, Jasmine, for sharing about your app, the Safe Space. I love the way you provided data to compare to other products in the market. Can you talk about how you will position the Safe Space as a different new product that integrates all of the core elements, but has a new offering that's unique from other competitors?
Absolutely. So to name some of my competitors, Safe Space has a competitor of BetterHelp, Brightside, and Calm, the app. The thing is, the main differentiator is that all of these resources are not affordable per se. And while conducting interviews, I also understood that the base of mental health is often related to just therapy or just pills or just treatment. But what are we doing to prevent those? What are we doing by other resources than just therapy or meditation for that matter? And the key differentiator is that the Safe Space keeps into consideration something called as compassion fatigue that therapists feel, and also that it empowers people to understand their emotions and choose what is best for them based on the resources that they have, which can be monetary or anything else otherwise.
I'd love to hear more about the types of resources that you're planning to list and what your criteria will be for inclusion.
Absolutely. So that's the reason I came to Hopkins, and I have been having heated conversations with my professors, because I believe that entertainment resources such as movies, music, any other types of content like blogs or podcasts can also be used for healing purposes or to provide people with information that they can access. And yeah, just in that way, people can maybe watch a movie and understand and, just get triggered by their emotions. Or there can be, because my model works with commission-based model as well. So sometimes food helps and sometimes traveling helps. So I think just providing a place for all of these resources in one spot and empowering people to choose according to their beliefs and what works best for them, I think that's what the Safe Space is going to be all about.
I'd be curious at how you plan on engaging with mental health professionals as a way of demonstrating the value of the Safe Space. Can you talk about your vision for partnership opportunities or collaborating with other services? What does that look like in terms of bringing in practitioners as a part of your engagement plan?
Absolutely. Thank you for that question. So Hopkins is the only place that has a department of mental health. And I am coming across a lot of professionals who want to help, but certain social medias algorithms don't work in and don't help them to provide that information. I mean, they want to reach out to more people, but I don't know, they can't dance on TikTok. They can't keep up with these trends. So after talking to a lot of professors, making them the influencers, making them as the sources of information for all the general users, I think that's what gives credibility to the safe space.
Any final questions? Oh,
Yeah,
go ahead.
Dear, I remember in your longer pitch, you talked about social media not being the best source for mental health support. Yet near the end, you also mentioned using social media to market the safe space. Kind of what is guiding your decision in terms of using social media, given that some people look at social media to find their mental health solve or to address any mental health challenges? What's your position? How do you strike that balance?
Yes. So after conducting certain interviews with psychologists and therapists and psychiatrists for that matter, who find it very unsafe to access other social media platforms because it is not designed for them per se. But yes, social media does connect you with other people. So because we all are there, because our friends and families are there, I just need to utilize or maybe just get my way through to reach those people that, hey, if mental health is your concern, and if that is what you're prioritizing, look at the other space that does provide you with those resources, and that has got nothing to do with all these different algorithms or misinformation that this particular social media provides for you.
Thank you.
Thank you.
Thank you so much, Jasmine, and thank you, judges. So that brings us to our final team of the day. Can't believe it. It's went by so quickly. At this time, Elise and Mabinti, if you can join my colleague Paul, I believe he shared a Zoom link in the chat, gracefully exit stage right and go ahead and deliberate. We appreciate you both.
Sephora, I'm wondering if we could pause the screen share here. And I wonder if we could go ahead and invite the judges from our first round to share some general thoughts for the cohort. So I know that Deborah is on the line and Sarah, and I'm wondering if Deb and Sarah, you wouldn't mind coming on video and sort of any general pointers or tips and tricks from your own experience as Hopkins founders that you might like to share with those that are tuned in today. And we'll turn it over to you first, Deb.
Yeah, absolutely. Really fantastic from absolutely everyone. And again, the 14-week is a huge commitment for the program. So just really that's shown through with all of your pitches. And I would definitely highlight what I saw with everyone was just the passion that you all pitched your projects with, and just continue to be passionate, continue to believe in what you're working on yourself, the team that you're working with, or the team that you're building. And I also would say, just kind of looking ahead, or just maybe some advice is embrace any pivots that you want to make on your journey. This is really just the beginning, and you all truly are taking something that maybe was a thought or an idea, and you're going through that process of making it a reality, making it a company, making it a product. And definitely embrace the pivots, because in all of the different fields you're all working in, the space is changing so rapidly, and don't be afraid to change.
Sarah?
Yeah, I want to echo what Deb said as well. Really fantastic job to all the entrepreneurs today. The pitches were really incredible. Some really interesting technology being developed out of Hopkins here, which is no surprise at all coming out of FFU. So yeah, I definitely agree with Deb. Be ready to change, be ready to pivot. Definitely learning that I've had from my company is don't get lost in sort of sunk cost fallacy there. You're always going to be learning so much through the whole journey. Things are going to be hard, things are going to take longer than expected, but if you really have that passion for the project, as Deb mentioned, then it really is all worth it. And would definitely also advise you to really take advantage of the Hopkins ecosystem, all of the advisors, all of the free resources that are available to you, those connections, all of the free office hours, regulatory advisors, legal advisors, all of that will be immensely valuable forward.
Wonderful words. And I'm wondering, in part, yes, we're waiting for the judges to get in here from the second part, but I'm wondering too, if I could ask each of you to kind of share just a few words about where you're working on now as entrepreneurs. And I'll just reverse it. And Sarah, if you wouldn't mind going first and telling us a little bit about Relavo and what you're doing, that'd be really cool.
Yeah, I'm happy to. So I'm CEO and co-founder of Relavo. We are a medical device startup that aims to increase the safety and accessibility of home dialysis by reducing infection risk. I actually started working on this technology when I was an undergrad at Hopkins in the biomedical engineering department as my kind of capstone design team, as I'm sure a lot of you are familiar with. And since graduating back in 2019, have been spinning this out into a full-time company. So as far as where we are now, I'm sure if I look back to all of the timelines and projections that I created while at Hopkins, those timelines were wildly different, but here we are kind of wrapping up our product development and looking for an FDA submission by end of next year. We've raised some significant money in the non-dilutive sphere from SBIR grants, as well as some investment from angel investors.
Deb, how about you?
Definitely. So I'm the co-founder of NewTech, and we are improving the safety as well as the diagnostic success rate of percutaneous lung biopsies. And it's, again, spun out of a design team project, like many, many teams are. And yeah, it's been a fantastic journey. I started and was in the design team program with this project in the 2019-2020 academic year. And then I actually just rejoined the team just a few months ago. And that was after I had co-founded and been CTO at Cranius, which also grew from the other VME design team project that I worked on. And the advice that I gave definitely is from experience of just, every single different, especially within the healthcare space, but also broadly, everything changes so quickly that adapting your technology is always so important. So it can really differ, of course, with your market space and your patient population and really unique challenges. And I'm also happy to talk with anyone about that, either teams, either projects afterwards. So feel free to reach out.
Thanks so much, Deb. And I do see that we have Mabinti back, which means that our final prizes are almost ready to be announced. But Mabinti, while we're waiting just a few more minutes, was wondering if you had any general pieces of feedback that you wanted to share with all those still on the call.
Fantastic. Thank you so much. I am really impressed by the variation and the thoughts and the innovation around each of the businesses or startups presented. The ideas were great and strong, and I really appreciated learning from you, kind of your perspective and what issues you will solve for in the future. I think overall, some did this in their presentation, but really thinking through what they wanted to achieve in the future. What does it look like in terms of funding? Once you receive funding, how do you scale? How do you market? How do you engage your target audiences? I think really emphasizing and detailing that as much as possible. And then even thinking about investments beyond other opportunities that may come up. Who is your ideal investor? Because finding an investor that aligns with your business model is critical. It's like a marriage, and it's like having an established relationship and making sure you have clarity on what type of funding you need for your innovation. Oftentimes, it may be tough, but turning down funding that may not align with where you are, maybe the funder doesn't know about your business model, maybe the funder is looking at taking a majority stake. So really thinking through what funding in the future looks like, and just being open to really refining your innovation, sharing it more with, your professors or people in your community to really refine on it and improve upon it. It's an iterative process, but certainly really think through, what does this look like in the next 5 years? Who would I like to partner with? And also think about your impact, your social impact, your environmental impact. Also consider sustainability. What sustainability measures will you have in place? I would also, really emphasize thinking through that sustainability piece, your ESG, would also be a helpful addition as you build and expand your various innovations in your startup. So I'm super excited for everyone who presented, and I look forward to seeing you all in the future.
Thanks, Mbinti. Very, very well said. And Elise, we wanted to be sure to give you the same opportunity, just asking all the judges to share just a few general words of feedback and encouragement for the cohort.
Awesome. Great job, everybody. Congratulations on getting to this point today. This is the start. This is certainly not the end. I wanted to say, running a startup is hard. You're going uphill. You have something new. And as much as you're excited about your new innovation, and usually everybody around you is really excited for the new innovation, the market is usually set up to prevent new companies from entering, and it's set up to protect the space that it currently has. And so I think the biggest thing that I learned is, just because you have something better, you have to also think about all the other market entry components. So that's price. That's how are you going to beat out the competitors that you have, not only just because your product is better, but because it's easier to integrate into your customer system, or easier for your customer to purchase, maybe because it's cheaper. I would just think about all of those components as well. And I think the biggest thing that kept me going, even when things got hard with my company, was I felt like our company was truly improving health equity. We did transparent masks, and so we were improving communication in all sorts of different settings, from healthcare and beyond. And thinking through that, if somebody has our product, they could prevent a misdiagnosis. They could actually be able to participate in school. They could have full access to different resources because they can use their native language, like ASL. That is what kept me going. And I thought, if I can get this mask to one more person, it can change their life. And so without that fire lit underneath you, it's an uphill battle. There's a lot against you, and it can be really tiring. So I would look within you to find out what that fire is within you, because that's what ultimately will keep you going.
Oh man, what a good word of encouragement and wisdom. Thank you for sharing. And again, cannot thank you judges enough for joining us today, and for all of our attendees. I know this is just the day before finals really kick in. So glad to have you on the line with us today. And with that, I think, Sephora, I think you're ready with your slides. So I'm going to turn it back over to you. Thanks, everybody.
Yes. Just allow me a second to bring us back. All right. I didn't get a chance to mention, but of course, we are active on several social media channels. Please make sure that you connect with us via Facebook, Twitter, Instagram, and we also have a newsletter for those of you that are unfamiliar, and that's how we also promote lots of events. So with that, the moment we've all been waiting for the first Audience Choice Prize of round 1, we have the proverbial drum roll. Complex DX, congratulations. And for the Judges Prize of $2,000 for our first round, we have BioLinko. Congratulations, team. For our second round Audience Choice Prize of $500, Early Birdie, congratulations. And last but certainly not least, our Judges Prize for our second round goes to Tivi. Thank you so much for all that came, pitched, presented, engaged, voted, asked questions. It takes a village. Thank you to our judges, to our staff, our strategic advisors and teams. I'm so glad to have ushered in this event and have seen the maturity of all the teams in this last semester. And this is not the end, like we say. And that brings us to the close of today's program. I will stay on for a little bit, but thank you all. Have a great afternoon and happy finals to anyone that still has them.